Hello and welcome. My name is Dr. Calliope and I'm going to be performing your examination today. How are you doing today? Okay, that's great to hear. So, I hope by the time you leave this office you feel even just the littlest bit better. So, let me grab my clipboard real quick and we'll get started. Let's see here. Do you mind if I just confirm your name and date of birth, please? Okay. Excellent. And is that the name you prefer to go by? Okay. Wonderful. So it looks like today we are doing a comprehensive physical examination. Is that correct? Okay. So for our comprehensive physical examination, we are going to be taking a look at all your different systems. We're going to take a look at your head, your scalp, your face, your neck, your hands and arms, your legs, your stomach, heart, lungs, all that good stuff, okay? Is there any particular reason why you wanted this examination? Okay. Wonderful. And are you currently experiencing any pain or illness? Okay, wonderful. And any changes to the medical history that we have on file? Okay. And what about family history? Nothing there? That's good to hear. Okay. And what about your allergies? Any changes to those at all? All right. And what about your medication list? Okay. Very good. All right. So I'm just going to ask you a couple questions to serve as our neurological assessment. All right. Real easy, real simple. Firstly, do you know what the current date is today? Okay, very good. And do you know the approximate time, or at least the time that your appointment started? Okay, wonderful. And where are we? Very good. All right. Okay, so I'm just going to set this down and I'm going to pop on a pair of gloves, okay? So it might take me just a moment to get these all wrestled on, right? Sometimes it helps with that sanitizer to dry out the hands a little bit, keep it from getting sticky, you know? Nobody likes a sticky hand. There we are. I'm just going to adjust the cuff of that, and there we are. Magical. So I'm going to just take a step back, and I'm going to take a very general inspection of you. I'm going to take a look at all of you as a whole and just note anything out of the ordinary down, okay? Alright, so I'm going to take a step back. Okay, and I'm just going to start at the top. And look at the head. And look at the shoulder here. Okay. Alright, everything looks good. I'm just making sure that your face is symmetrical, that everything is relatively symmetrical, right? I'm going to move on, and I'm going to be touching you throughout this examination. Is that okay with you? Do I have your permission to do that? Wonderful. So I'm just going to jot down about our general inspection, and then we'll move on to taking a look at your scalp. Here we go. Okay, so we're going to start taking a look at your scalp. So I'm going to look at your hairline first, and then we'll just work through there, okay? So I'm just going to come in pretty close. Just take a look at the hairline of your head. Just noting down if there are any patches of dryness, oil, irritation, anything of that sort, any signs of an infection or anything that might be bothering you. Have you had any symptoms regarding your head or your scalp at all the last couple of weeks? Any itchiness or pain, any swelling? Okay. Alright, so I'm just going to come up a bit, and I'm just going to rifle through the hair a touch. And I just want to look around just very generally. You doing okay so far? Okay, just want to make sure that I'm not putting too much pressure or hurting in any way at all. So I'm just going to take a look at the back real quick. Just going to come to the side and just look at the back of the head here. And the other side, I'm just going to come to the side and just take a look at the back. Okay. Alright, so now I'm going to feel the contours, the ridges, all the little bony structures that make up your cranium, okay? I just want to feel if there are any lumps or bumps that shouldn't be there. Okay. Very good. And while I'm back here, I'm just going to go ahead and feel the occiput and the occipital lymph nodes here, okay? Have you experienced any pain or tenderness in any of this? Okay, I'm going to come to the post-auricular lymph nodes right here, okay? Right, nothing there. And how about the pre-auricular lymph nodes right here? Okay, that's been fine. So I'm just going to take some notes down regarding your head. We'll start moving on to your neck. Okay, so I'm going to work and just feel the tonsillar lymph nodes. We're going to feel your submental, submandibular, the different cervical lymph nodes, as well as your supraclavicular lymph nodes. Are you feeling any pain, any tenderness in any of this? Okay. wasn't any swelling in any of the lymph nodes, and no pain, no tenderness. So now I'm just going to be feeling your thyroid. So I'm just going to put my fingers right on your throat. I'm not going to press very deeply, and I want you to just swallow for me, okay? Okay. I'm going to come around to the back and do the same thing. Okay. Can you go ahead and just swallow for me? Okay. Very good. And this might be a touch uncomfortable, but I'm going to be feeling your windpipe, okay? It won't be very long, but it might be uncomfortable, okay? So I'm just going to just feel that. Okay. Alright, very good. So I'm going to pop in a stethoscope, and we're going to listen for any bruits in your carotid artery. Bruits are an audible heart murmur, okay? Alright. I'm just going to pop in my stethoscope. Alright, and would you mind turning your head to the side? Doesn't matter which side. Okay. Take a deep breath in and hold for me. Very good. Okay. Excellent. You can go ahead and exhale. And turn your head to the other side. And take a deep breath in for me. And hold. Okay. Very good. That sounds great. So, I'm just going to set this down. So, let's go ahead and take a look at your face. So, I'm just going to look at your face as a whole and just make sure that everything is symmetrical, that there aren't any obvious abnormalities. Okay. Alright, so I'm just going to be feeling your jaw, and I'm going to have you do a couple of things with that, okay? So can you just clench your jaw for me? Okay, and then can you open your jaw and close and open and close? Excellent. Okay, that feels good. So I'm just going to feel your temples here. And can you clench your jaw? And you can unclench it. Okay, was there any pain or tenderness in any of that? Okay, so now I'm going to be palpating along your sinus cavities, alright? So I might do a little tapping, and I want you to let me know if there's any pain or tenderness, okay? Have you had any issues with your sinuses? Okay, just a bit of pressure with the weather. I understand that. Sinus cavities are very fickle things. Okay. And there's been no pain, no tenderness in any of that? Okay, very good. Okay, so now we're going to be taking a look at your eyes and doing some inspections, doing some tests, okay? Have you had any problems with your eyes, with your vision, anything of the sort? Okay. Very good. So I'm going to set this down and then we'll get a little closer look. Okay, so I'm going to take a look at your eyes and I'm just going to look at the eyebrows. I'll look at the eyelashes. Okay, take a look at how your sclera looks, the color, how your pupils look. Okay. And now I want to check your conjunctiva. So I'm going to pull your eyelids up and I want you to look down, okay? Pulling up, look down. Very good, okay? And now I'm going to pull down and I'll have you look up. Very good, okay. And your tear ducts look nice and pink and moist. Not red, not irritated or anything. Your conjunctiva looks nice and clear. Your sclera is a clear color. So that's very good, okay? So next we're going to do the Snellen chart test. After I just note down, there we go. So the Snellen chart test is right behind us here. So this is your eye chart test for your visual acuity, okay? So I'm just going to be stepping back and approaching our little Snellen chart there. And I'm just going to have you just read off whatever letter that I point to you, okay? I want you to just look here and just let me know what letter I'm pointing to. Good. 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 Yes. Yes. Good. Good. Okay. I'm gonna have you cover one eye. Doesn't matter which one. All right. Okay. Let's do that again. Good. 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 Yes. Yes. Good. 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 Yes. Yes. Good. 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 What about here? Okay. Good. 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 Very good. Okay. If you wouldn't mind just covering the other eye for me. Okay. Let's do. Good. Okay. And what about here? Good. 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 And let's do here. Good. 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 Okay. And what about here? Good. Good. Last one. Good. 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 Perfect. Wonderful. That's great. So that looked very good. So now we're going to do some light tests, okay? So I'm just going to be using our pen light for this. And for our first test, we're going to be doing the direct consensual response test. So what I'm going to do, I'm going to put my hand up between your two eyes, okay? Just like this. I'm going to bring my light in to one eye and shine my light into it. In a normal test, when I shine the light into that eye, your pupil should react to the light. And that will be our direct response because the light is being directly shined into it. Now, for the consensual response, if I were to bring that light to that same eye and this eye reacts, the other eye should react the same time in the same way, even though the light's not being shined into it. That would be our consensual response, as it is consensually reacting to the light with the eye that's being directly shined into, okay? All right, so you don't have to do absolutely anything save for look straight ahead, okay? I'm going to put up my hand between your eyes. I'm just going to bring in my light. Direct. Direct. Direct response. Consensual. 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 Wonderful. We're going to do that for the other eye. Direct. Direct. Direct response. Consensual. Consensual. Consensual response. Excellent. So now I'm going to do the swinging light test, which just means that I'm going to swing the light back and forth between your eyes to look for any defects in the way that your eye reacts, okay? So again, just stare straight ahead for me. Okay. I'm just going to bring the light in and swing it around and swing and swing, swing, swing. Very good. Okay. So now we are going to test your eye movements, and I'm going to step back and I'm going to hold up my finger, and I'm just going to have you follow my finger using only your eyes without moving your head, okay? So I'm going to step back. I want you to just focus on my finger here and follow my finger using only your eyes without moving your head. Good. Good. Yeah. You're doing perfectly. Just follow the finger. Follow the finger. Very good. Okay. We're going to switch it up a bit. We're going to go up, down, okay, the side, to the side, okay, up, down, to the side, to the side. Okay, and then we're gonna go diagonally up, diagonally down, diagonally down, diagonally up, diagonally up, diagonally down, diagonally down, diagonally up. Very good. Now I want to test your accommodation reflex. So I'm going to have you keep following the finger. Keep your eyes focused on my finger, using only your eyes without moving your head, okay? I'm just going to be coming in and out and in and out and in and out. Very good. And let's do that on the other side. Keep your eyes focused on this finger, using only your eyes without moving your head. We're gonna go in and out and in and out and in and out. Very good. So now I want to check your visual fields. I want to test your peripheral vision a little bit. I'm going to have you just focus your eyes on my nose, okay? And I'm going to have my fingers in your peripheral vision, and I'm going to wiggle one or the other, and I just want you to let me know if you see the left wiggling or the right, okay? So keep your eyes fixed on my nose. Just let me know which side you see wiggling. Good. Good. Mm-hmm. Mm-hmm. Good. Mm-hmm. Good. Mm-hmm. Good. 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 Mm-hmm. Mm-hmm. Perfect. That's wonderful. Let me go ahead and jot a few things down, okay? Alright, so lastly, with your eyes, we are going to be doing a fundoscopy. So I'm going to grab my ophthalmoscope real quick. So I'm just going to screw this tool in. Yeah, nice quick screw. Always a good thing. Okay, and I've got my light. So a fundoscopy with an ophthalmoscope is a little test that I do to check the back of your eye, to check the health of your optic nerve and the tissues and nerves that surround it, okay? So I'm going to be standing at the side of you, kind of at a diagonal. I'll put my hand on top of your head to steady myself, and then I'm just going to be bringing myself and the ophthalmoscope in closer to your eyes so that I can get a good look around, okay? Okay, so I'm going to stand to the side, and I'm going to turn on my light. Okay, I'm going to put my hand on top of your head, and I'm just going to search around for the red light reflex in your eye. Okay, and then I'm going to come in closer. right? Come to the other side here. Just move my table a bit. There we are. So I'm just going to put my hand on top of your head. And I'm just going to look for that red light reflex. Okay, and then I'm going to come in closer and just take a little look around at the back of your eye. Okay. Looks clear. I'm not seeing any issues at all. Okay. Right. That looks great. So I'm going to pop this off. I'll be needing it for the next portion. There we go. And this time I'm going to pop on my otoscope so that we can move on to the ear portion of the exam. There we go. Okay. Alright, so have you been experiencing any hearing difficulties or any problems with your ears at all? Okay, very good. Alright. So I want to just real quick have a little peek at your ears, at the structure. I'm going to be doing a little inspection just with my eyes and a little bit of palpation, okay? So I'm just going to start at one ear and then the other. So I'm just going to come in and take a look at the ear and just look to see if there is any issues with the ear itself. Any redness, any discoloration. Right, that looks good. Okay. Right, and the other side here. Just going to have a little look at the ear and palpate different structures a bit. Looking at the back of the ear here. Okay. Alright, I'm going to do some light palpation bilaterally here. Okay. Alright, very good. So now I'm going to take a look at the insides of your ears with the otoscope. So I'm just going to pop on a clean speculum for that purpose. Okay, I'm just going to twist that on. There we go, just like that. So I'm just going to be pulling up and back on the pinna, top of the helix, and I'll be just very gently inserting the otoscope into the ear canal and taking a look inside, okay? Alright, so I'm just going to step to the side and turn on my light. There we go. And just going to pull up and back on the ear and then very gently insert the otoscope into the ear canal. So I'm looking mainly in the ear canal for Now we're going to move to the other side. Just going to move our table a bit and just going to pull up and back on the ear. And then very gently insert the otoscope into the ear canal. So the ear canal is also called the external auditory medius. And what the inside of your ear is, where I can see, is actually the middle ear. And behind the tympanic membrane, behind the eardrum, is your inner ear. The malleus, the stapes, and all that. So at the otoscope, I can see a cone of light from the otoscope bouncing back at me. I can see the tip of the malleus through the tympanic membrane. And the tympanic membrane should be like a pearly gray color. Okay, just gonna pull that out. Okay. Just gonna turn off the otoscope and take off that speculum. Okay. So I didn't see anything to be concerned of. There wasn't a buildup of cerumen, there's no irritation, no swelling. There's not even any water in the ears, which is good because that can be really painful and really irritating. Okay. So now we're going to do a small little hearing test, okay? So I'm just going to rub my fingers together, rustle them a bit, and I just want you to let me know which side you hear it on, okay? So I want you to close your eyes for me, okay? And then I'm just going to rustle my fingers, and I just want you to let me know left or right, okay? Very good. Good. Yeah. Very good. Okay. And now I'm going to be just rubbing my fingers and bringing them in towards your ears. I want you to let me know when you start to hear them, okay? Okay. 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 All right. And now I'm going to do that, but I'm going to go away. I want you to let me know when you stop hearing them, okay? Good. Perfect. Perfect. Wonderful. So lastly, for your ears, we're going to do the Weber and Rene test. So the Weber and Rene test involves a tuning fork. This is a 512 hertz tuning fork. Okay, high pitch sort of noise. So for the first test, I'm going to strike the tuning fork, and I'm going to put it in the middle of your forehead, kind of a little bit above your forehead. And I just want you to let me know if you hear the sound more on one side or the other, or right in the middle, okay? All right. Where do you hear that sound? Okay. Where do you hear it? All right, right down the middle. Very good. So now I'm going to strike the tuning fork, and I'm going to put it on your mastoid process right behind your ear. There's a little bony area right behind the ear. And I just want you to let me know when you hear it and when you stop hearing it. When you stop hearing it, I'm going to bring it right in front of your ear. I want you to let me know when you hear it and then when you stop hearing it, okay? Hear that? When does it stop? Hear that? When does it stop? Good. Hear that? When does it stop? Hear that? When does it stop? Good. Hear that? When does it stop? Hear that? When does it stop? Okay, it was a little softer, right? Hear that? Much better. Okay, stopped. Hear that? And it stopped. Okay. All right. Very good. Okay, so next we're going to be moving on to your nose, your mouth, your throat area. So have you had any issues lately with your sense of taste or your sense of smell? Okay, very good. So I'm going to put a new speculum on the otoscope and we're going to take a look inside the nose, okay? Alright, I'm just going to pop that on. There we go. Okay, so this will actually not go into your nose at all, okay? But it's just like a little precautionary measure, right? I'm going to have you tip your head back. I'm going to turn on the light. I'm going to look inside of your nose, okay? Alright, so just going to have a little peek there. Alright. Yeah, it looked really good. I don't see any issues with the septum, okay? I'll look at the other side. Very good. That looks like one healthy little nose there. Excellent. Okay. Alright, and I'm going to use this without the speculum, and I'm going to have you just open your mouth for me, okay? Alright. And can you lift your tongue to the roof of your mouth? Okay, very good. I'm going to grab a tongue depressor real quick. Ready to go ahead and put your tongue down. And I'm just going to push your tongue down. Can you say ah for me? Very good. Okay. Your throat looks good. There doesn't seem to be any redness or irritation or anything. Do you get sore throats often? No, not really. Okay, that's very good. All right. Okay, I'm just gonna look at the nose and mouth itself. Just the skin of the structures themselves. Okay. Do you get cold sores at all? No? Okay. That's good. Good to hear. Alright, very good. So next we're going to be testing your trigeminal nerve, your cranial nerve. And that governs your sensation on your face. For the most part. So there are 3 branches of the trigeminal nerve. That's why it has the name trigeminal, right? 3, tri. And on your face, you have the ophthalmic branch of the nerve. You have the mandibular, or maxillary rather, always get them mixed up. The maxillary branch right here, and the mandibular branch right here. So named for the areas that they govern. So I'm going to get a cotton bud and a toothpick, and we're going to do a little soft, sharp sensation test, okay? All right, so we have a cotton bud, we have a toothpick that has never been used, and I'm just going to just stroke that along your jaw and just poke you real quick so you can see what the sensations feel like and that it's not painful at all. So this won't break the skin. It's just a little concentrated point of sensation. Okay, I'm just going to stroke your jaw here. Okay, feel that? And toothpick. Okay, so everything feels all right? Okay, I'm gonna have you close your eyes and I want you to tell me whether you feel soft or sharp, okay? Right. Soft. Sharp. Soft. Sharp. Soft. Okay. Sharp. Sharp. Soft. Sharp. Soft. Soft. Very good. Okay, that's excellent. Alright, and then we're going to test your facial movement a little bit. Okay, so can you raise your eyebrows for me? Okay, very good. And can you close your eyes real tight for me? Can you puff out your cheeks? Very good. Can you smile real wide for me? Okay, very good. And can you stick out your tongue for me? Okay, can you move that from one side to the other? And what about up and down? Very good. Okay, and I want to test your head range of movement a little bit. So would you mind just turning your head from one side to the other? Just one side and the other. Okay, and what about up and down? Okay, and can you tilt your head to one shoulder and then the other? Very good. All right. Okay, so let's move away from your head situation, okay? Let's move on. So we're going to take a listen to your lungs. So we're going to start with the front of your chest and then we'll move to the back of you, okay? So I'm going to auscultate your lungs first and I just want you to take deep breaths when prompted, okay? So, deep breath in and out. 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 Very good. Now I want to take a listen to the vocal resonance in your lungs. So when I put the stethoscope on your chest, I want you to say the word 99 for me, okay? Really enunciate 99, right? Okay. 99. 99. 99. 99. 99. 99. Okay, very good. So now we're going to do a little percussion, all right? So for percussion, I'm just going to be putting my hand on your chest where your lungs are at, and I'm going to be tapping with my fingers, okay? And I'm just listening for the sounds that come back from that, okay? All right, so just want you to just breathe normally for me, okay? Okay, very good. So we're going to do all of that, but I'm going to do it on your back, okay? So I'll be out of view for a little bit, all right? But I'll tell you everything you got to do, okay? All right. All right, so I'm going to have you take a deep breath in and out. 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 Okay, so we're going to do our vocal resonance. So when you feel my stethoscope on your back, just say the word 99, okay? 99, 99, 99, 99, 99, 99, 99, 99. Okay. I'm going to come back around and put my stethoscope down. And then I'm going to go to your back again and we'll do some percussion, okay? All right, I'll be right there. Okay, so I want you to just breathe normally for me. Okay, very good. So I'm just going to feel your spine while I'm back here, okay? So please just let me know if there is any pain or tenderness, okay? Just gonna feel each vertebrae, starting at the cervical spine, thoracic spine, the lumbar spine. Okay, and I'm just going to feel your sacrum here. Okay, very good. I'm going to come back around. All right, that sounded excellent. So now I'm going to be looking at your heart and taking a listen, okay? So first I'm just going to locate the apex beat, okay? It's on the mid-clavicular line, 5th intercostal space. Okay, right there. Okay, very good. All right. Now I want you to just breathe normally for me, and I'm going to listen to the different valves of your heart. So we're going to listen to the mitral and the tricuspid and the pulmonary and the aortic. Okay, very good. Right. Is simple enough. So I'm gonna have you lay back now, okay? We're gonna do a few tests while you are laid down. All right. So firstly, I'm going to look for any jugular venous dissension. We're gonna just take a peek at your JVP, all right? So I want you to go ahead and turn your head to the right side for me, okay? Do you have any pain in your liver area at all right here? Okay, no pain in your abdomen? Very good. All right, so I'm going to press down real firm. It might be a touch uncomfortable. I'm just going to look at your neck while I'm doing that, all right? Okay. All right, very good. Okay. Now I'm just going to palpate your carotid, and I'm going to listen for bruits again, okay? Right. I want you to just take a deep breath in for me. And hold. Okay, you can exhale and then take a deep breath again. And hold. Very good. Okay. Go ahead and breathe normally. And then I'm just going to have a little listen to your abdomen, okay? All right. Just breathe normally for me. Just going to listen to different sections of your abdomen. Have you had any issues with your digestive system at all? Okay. No pain or tenderness? All right. Okay. And now we're going to do some palpation, all right? So I'm going to do these in 2 different pressures. So firstly, I'm going to go in with a light pressure, and then I'll go in with more of a deep pressure, okay? Deep pressure might be a touch uncomfortable, all right? So I'm just going to lightly feel around your abdomen. Just feeling the different organs, feeling the borders. Utterly fascinating, and then okay, and now I'm going to go in with a deeper pressure. Might be a bit uncomfortable, okay? Are you experiencing any pain or tenderness? Okay. Is that a bit? No? Okay. Alrighty, so I'm going to go ahead and percuss then. So just like on your lungs, I'm just going to tap on my fingers. Okay, very good. Alright, so while I'm taking notes, you can go ahead and come back up to sitting. Alright, we are just trucking along here. So we're going to go ahead and take a look at your hands. I want you to just hold up your hands for me and splay your fingers out, okay? All right, and I'm just going to inspect the skin of your hands. I might turn them over for you. Looking at the skin and the nails. Okay, I'm going to turn your hand over. You had any joint pain or any issues with movement or flexibility in your hands? Okay, I'm going to turn them back over and I'm just going to check the capillary refill in all your fingers. Just press firmly on the finger and then release. Right, and now I'm going to palpate each joint of your fingers, okay? Please let me know if there's any pain or tenderness, all right? All right, doing okay? Alrighty, excellent. So I'm going to try to push your fingers together, okay? I want you to resist me. Okay, very good. And can you squeeze my hands as hard as you can? All right, very good. Let's see, just take some notes. Okay. Okay, can you make a fist for me? All right, can you turn your hands up, down? Okay, can you move them in and out? Very good. Can you extend your arms all the way out? And then can you put them all the way back, like that? Okay, kind of like a Naruto run, right? Yeah. Okay, so would you mind just putting your arms up like this? Okay, I'm going to try to pull you towards me. I want you to resist me. Okay, and now I'm going to try to push on your arms. I want you to resist me. Okay, and now I just want to have a look at your elbows. Okay, very good. Oh, gloves. Alright, so I'm going to finish the notes on that and then we'll have a look at your legs. Okay, so I'm going to be ducking out of view for a little bit while I take a look at your legs, okay? Alright, so just going to get down a bit. Oh, I feel like I'm too old for this sometimes. Alright, so I'm just going to take a general inspection of your legs here, okay? Have you had any problems with any pain or any stiffness, any issues with flexibility or mobility? Okay, been pretty alright. So good. Okay, I'm just going to feel the different pulses in your legs, okay? So I'm just going to feel the back of your legs here and your pedal pulse. And just on the top of your foot here. Very good. Okay. So I'm going to pull your legs upwards, okay? Please let me know if there's any pain. Okay, all good? All right, I'm going to put them back down. So I'm going to put my hands on your shins and I want you to push them against my hand. Okay, very good. And I'm going to put my hands on top of your thighs. I want you to just push them up against my hand. Okay, and now I'm going to put my hands on top of your feet. I want you to push them up against my hand. Okay, so now I'm going to test a little bit of range of movement, okay? So firstly, I'm going to try to just push and pull your toes a little bit, okay? All right, very good. Now can you push your toes upwards against my hand here? All right, and can you pull them against my hands here? Very good. I'm just gonna push on your feet a bit. Okay, very good. So I'm gonna check your reflexes on the back of your ankle and the bottom of your foot. So I'm just going to run my reflex hammer, the end of my reflex hammer against your foot, okay? All right, very good. And let me check your Achilles tendon reflex here. Very good. Very good, excellent. So I'm gonna stand up. All right, we made it. So now I want to check your knee jerk reflex, okay? So just relax your leg. Very good. Yep. Very good. Okay, so now I'm going to check your brachial reflex. So I just want you to relax your arms, and I'm going to put my thumb on top of your elbow and my fingers around your elbow. Okay. Very good. Okay, and the other arm. Very good. And now I want to check your triceps reflex. So I'm going to hold your arm up, and I'm just going to be tapping along the back of your elbow, okay? Very good. Okay. And just let me take your arm. Very good. Okay, let's go ahead and put that down there. All right. So I'm going to take a few notes regarding your legs and your reflex tests. And then we're going to do a little musculoskeletal exam. And then that'll finish up our examination, okay? All right. Okay, so I'm going to have you stand up for me. Very good. And can you put your arms all the way over your head? Okay, and can you swing them all the way back? Okay, very good. Can you put them to the side? And then all the way up. Okay, check, 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 and check. Very good. So I'm gonna have you raise your arms up in front and then put the backs of your palms together, okay? All the way extended, and then just bring that all the way up as far as you can. Okay, any pain at all with that? All right, you can go ahead and relax then. Okay, very good. So I'm gonna do a little spinal examination. I'm just gonna go to the back of you, and then I'll have you bend forward while I'm feeling around your spine, okay? So I'll be right back. Okay, so I've got my hands along your spine, and I just want you to very slowly bend forward, okay? Slow as you can. Okay, you can go ahead and stop. And there we go. Go ahead and come back up, okay? lastly, I'm going to test your balance a little bit, okay? So I'm going to have you close your eyes and just put your arms at your side, okay? I'm going to try to sway you. I want you to not let me sway you at all, okay? All right, very good. Can you put your arms up in front with your eyes still closed? I'm going to go ahead and just push down. Okay, all right, you can go ahead and put your arms back and open your eyes. And then I'm going to have you just walk to the end of the room here. I'm going to have you do it on your heels, okay? So with your toes up, heels on the floor, walk on your heels. Okay, and can you come back on your toes? Okay, and can you go back, but this time go heel to toe and walk like that? And then can you just come back normally? Okay, very good. So that concludes our comprehensive physical examination. It was quite a lot, wasn't it? I feel like I've gotten very acquainted with you. So let me go ahead and finish up my notes real quick and then we'll sign off. Do you have absolutely any questions for me? Okay. Yeah, it was an excellent test. You passed with flying colors. I didn't see absolutely anything out of the ordinary. Nothing to be concerned of. You're a very healthy individual. Okay. All right, so let me go ahead and sign off. Very good. And if you don't have any other questions for me, then we can conclude the exam. All right. Thank you so much for coming into my clinic today to get your comprehensive physical examination from me. Really appreciate having you here. I hope you have a whale of a day. And I hope you have a good rest of your night. Thank you so much.